Hello, I'm Pinakin Davey, Professor of Optometry at Western University of Health Sciences, and it is indeed my pleasure to welcome you to this video series. Which perimeter shall I buy? Very difficult question and very important. Ideally, money is not an issue and you will have one of each of these because every single perimeter has some bonus. So there you go, end of lecture. Not so fast. We have to consider some features. What is the size of the perimeter? Because space is always a premium. What is the cost of the device? Again, ideally not an issue, but let's face it, in reality, practices that are focused on managing disease needs a lot of equipment, and so cost does become an issue. Do you perform a screening? Well, who doesn't? If patients complain of headaches, we have to perform a screening protocol. Does this person have glaucoma? So, for example, pulsar perimeter has white-on-white perimetry, but also performs screening protocols. Matrix perimeter does threshold perimetry, does not do white-on-white, but has screening protocols. So something to consider. Then, are we interested in central testing or peripheral testing? Now, if you're interested in only central visual fields, like for example, glaucoma and macular degeneration, just central specific visual field, for example, an Octopus 600 with a pulsar perimeter might be just enough to have. Or if you're interested in far out periphery or to perform kinetic perimetry testing, then perhaps a Octopus 900 might be more suitable. Do you require kinetic perimetry? Now, some specialty offices are interested in low vision, disability testing, and in fact, a true Goldmann perimetry is the only thing that is acceptable for disability testing. An Octopus 900 does have the exact dimensions of a true Goldmann perimeter. We need a perimeter that does multiple testing. Multimodal testing is very, very crucial. Has to do screening, has to do white-on-white perimetry, and if it can do specific ganglion cell testing, it would be ideal. And on top of everything, if it can do kinetic as well. So Octopus 900 can perform kinetic testing, can perform white-on-white testing, can do, of course, blue-yellow perimetry as well, but is a little large. Something to consider. Octopus 600, smaller footprint, portable, more convenient, great for central protocols, fantastic for magnocellular testing. Here's Heidelberg Edge perimeter, again does white-on-white perimetry, can do specific magnocellular testing. Here's the Humphrey field analyzer, can perform blue-yellow perimetry, does not do M-cell testing, does blue-yellow perimetry, K-cell testing, and performs white-on-white perimetry. The next important question is the data interchangeable? We may have an older perimeter and we are planning to buy a new one because the old one broke down or we need an upgrade for various reasons. A very important question to ask is the data interchangeable? Where glaucoma is concerned, baseline is everything. Losing baseline testing in a patient is like losing yourself in a galaxy without the coordinates. So it's a real problem. Octopus perimeter can transfer data from other perimetric techniques into itself. And this is very valuable because you don't lose the baseline data in a patient. Other things to consider are software and analysis procedures. Does it have various analysis techniques that we need to look at the data and slice and dice in different ways? Structure function correlation plots, progression plots. Can you customize the printout to your need? You may be interested in only 4 parts of a visual field, or you may be interested in a simple plot that can explain it to the patient. So can the printout be customizable to your need? Can it be transferred to electronic health record without a problem? Or do you need to purchase a huge software to buy this? All these are important points and one needs to consider. In summary, I'd like to say choose wisely because you will be living with this perimeter and your choice for a very long time. Thank you very much.